my channel. It's Carrie Ann Johnson here, and today I'm going to talk about what is insomnia. And we have made a video before that spoke about the different types of insomnia, causes of insomnia, and how to treat it naturally. In this video, I will focus more on medications used to treat insomnia, both over-the-counter non-prescription and some of the prescription drugs, and some herbal medications that can be used to treat insomnia. So just let us review what is insomnia. So insomnia is a sleeping disorder, and patients find it hard to fall asleep and it's difficult to stay asleep, and they tend to wake up too early and cannot go back to sleep. So non-prescription sleeping aids or over-the-counter sleeping aids that you may find in pharmacies can be Unisum, ZQuil, Tylenol PM, Advil PM, Simply Sleep, Sominex, and Alteril. There are other brands that are in different countries, but these are just some of the examples of over-the-counter sleep aids that are available. Over-the-counter sleeping medication usually contains an antihistamine, such as Hyphen or doxylamine. When using over-the-counter sleep aids, consider any potential side effects like drowsiness or contraindications, things that makes it not appropriate to be used. Take the lowest effective doses and only take them for a short period, no longer than 2 weeks. So let's look at diphenhydramine, which is one of the antihistamine, and that's the active ingredient that you will find in some over-the-counter sleep aids. And the typical dose is 25 milligrams to 50 milligrams, so that's 1 to 2 tablets, and it's usually taken 30 to 60 minutes before you go to bed. The onset of action is 1 hour to 3 hours, hence you will take it 60 minutes before going to bed at least. Benefits are it can improve your sleep onset, your sleeping duration, and the quality of sleep. Patients can develop tolerance to the sedative effects, and some of the common side effects, of course, include drowsiness, morning grogginess, dizziness. Other side effects can include urinary retention, dry mouth, or constipation. Doxylamine is another active ingredient that you find in some sleep aids, such as Unisum, and the dose is 25 milligrams 30 minutes before bedtime. The onset of action ends is 1 hour to 2 hours. Side effects can include feeling tired, you have an hangover effect because it has a long half-life, and you may notice anticholinergic side effects such as dry mouth, constipation. These are usually rare. So sleep aid is not recommended for everyone. So this is what we call a contraindication. So avoid taking over-the-counter sleeping aids if you have these conditions: glaucoma, or if you have enlarged prostate, which is benign prostatic hyperplasia, or BPH. If you have arrhythmia or rapid heartbeat, which is a heart condition, avoid taking sleep aids. If you have severe constipation or severe dry eye conditions, I recommend not to take sleep aids. There are some natural herbal products that are used to improve sleep, and one of the common ones is valerian root. The dose is typically 400 to 900 milligrams, and it can be taken in tablet form or in tea form, and it's usually taken 30 to 60 minutes before bedtime. Side effects again can include hangover or morning drowsiness, dizziness, headaches, nausea, and there can be a rare side effect of hepatotoxicity, so it can be hard on your liver. So it's not recommended for everyone to take this medication, especially if you have severe medical conditions. Melatonin is also another natural remedy for sleep, for insomnia, that is, and it is a hormone that is produced by your pineal gland. And what happens is when you're exposed to sunlight, it produces melatonin, and melatonin regulates your sleep-wake cycle. So if you don't get enough exposure to sunlight, then you don't produce enough melatonin. Hence, this can cause insomnia. So melatonin is a natural sleep aid, and it's recommended for people who do like shift work or people who are traveling from different time zones. Some people find it effective and some people find that it doesn't work. So it will vary from patient to patient. It's effective to increase your sleeping time. It relieves or prevents daytime fatigue associated with jet lag. It can reduce sleep latency and reset the sleep-wake cycle. Side effects can include some fatigue is possible, dizziness, or headaches. Magnesium or calcium supplements are also used to help with sleep, and they help to relax the nervous system, and they can be taken at bedtime to help with insomnia. For magnesium, you will take a 250 milligram tablet. For calcium, you can take a 500 milligram tablets. These have limitations to their doses. So if you take too much magnesium, that can lead to diarrhea. And if you take too much calcium, that can affect your heart. So speak to your health provider if you're concerned taking these supplements to help with insomnia. And they can also interact with your other medications. So it's important to space these medications at least 2 to 4 hours from your other medications. Other sources of magnesium can be green leafy vegetables, nuts, seeds, legumes, or whole grain. The benzodiazepines are a class of medications that are used as hypnotics, and they're generally prescribed for insomnia. So if you have severe insomnia and you go to your doctor, more than likely they will put you on a benzodiazepine. Some of the examples include Hyphen or lorazepam, that's a generic name. There's also the non-benzodiazepine agonist, such as zopiclone, which the brand name is Imovane. Antidepressants can also be used if the patient has insomnia associated with depression. For counseling tips, just a few general advice for people who are taking over-the-counter products, natural products, or prescription drugs. We always advise them do not drive or operate vehicles or machinery when taking sleeping aids because they cause drowsiness, they cause hangover effect, and there's increased risk of accidents or harm to oneself if we're taking these medications and we're operating vehicles or machinery. Do not drink alcoholic beverage while taking sedating medications because it increases the drowsiness side effect. Do not take over-the-counter sleeping aids for longer than 2 weeks. If you're taking over-the-counter medications for longer than 2 weeks and your insomnia is not improved, please speak to your doctor about this. If you experience chronic insomnia, as I said before, consult your doctor for appropriate treatment. Okay guys, so this video was about insomnia. It's an informative video and it is not intended to be substituted for medical advice from your doctor. Please continue to follow your doctor's specific instructions, and I hope you found this informative. Thank you for watching. Remember to like, comment, and subscribe. It's Carrie the Chemist here. Have a good day. Bye.